Each year, prior to the start of the legislative session, we invite advocates supporting various issues to tell us what they'd like to see from lawmakers in the new session. We hear from education, business, and environmental advocates later in the week. Tonight, the focus is children's issues, and joining us is January Contreras, Executive Director of Children's Action Alliance. Good to see you again. Thanks for joining us.
Glad to be here again.
When we talk about a legislative agenda, define that for me.
We have legislators that are elected by Arizonans all across the state. They have a lot of kiddos around their homes, and it means that the legislature is going to pay attention to what parents and kids' needs are moving forward.
So, but when you say legislative agenda, that means what you're going to focus on, what you're going to focus on even more? I mean, again, how does that work?
The legislative agenda for Children's Action Alliance is what are we going to be out there proactively fighting for, and what are we really going to be defending? So that legislative agenda has two parts, right? Some of it is a bill that we're asking, and legislators from both parties have agreed to move forward. And a lot of our work, always, when it comes to kids, is we're just defending some of the great things we already have for kids.
Yeah, a lot of defense, I would imagine, goes on there. Healthcare, protecting access, if you will.
Yes.
It's got to be part of the agenda.
Absolutely. Healthcare is maybe even number one this year. In Arizona, we are still at the bottom 5 of the country in terms of the number of uninsured kids we have. It's too high. Now, the good news is last year, even among budget deficits, the legislature and Governor Hobbs came forward and they managed to expand kids care.
Yes.
Health insurance program for working families, 10,000 more kids eligible. So the good news is we have moved up, and our rate of uninsured kids has improved. We still have so far to go, though, and protecting access and kids care is important for kids, for their families, and also for the state's economy.
And protecting suggests that they are threatened. Do you still feel they're threatened?
Look, we've had important wins, so I want to give credit to the legislature and the governor. But we're hearing a lot of chatter at the federal level. There is a committee set up of people who are new to government who are looking to cut $2 trillion. And when you're looking to cut $2 trillion, Medicaid, which is a very important source of federal funds here, it is going to be one of the things that they talk about. So we've seen a lot of proposals that have us concerned, and we want to do our best to help legislators and policymakers understand what those dollars do, not just for people, kids, seniors, people with disabilities, but also for our economy and jobs.
Early learning in general, part of the agenda?
Absolutely.
How so?
Childcare.
Yeah.
I go to listening sessions all around the state. I've gone all around the country in previous positions. Parents are at their wits' end with childcare. Some not able to take on jobs, some having to reduce hours. They just can't afford it. And so we want to continue to do what we can in this state to make resources available, and also what are the innovative things we can be doing to create more access to childcare for kids.
Especially, I would imagine, especially important in rural areas.
It's true. Rural areas just don't have enough licensed child care facilities, and the providers that are out there don't have enough support to make it. So rural areas really need attention for child care.
Overall economic support to help families. You could probably put this in the preceding two things we've talked about. That's overriding, is it not?
Absolutely. You know, there are all kinds of consequences when a family isn't able to keep a roof over their kid's head, when they can't put enough food in their belly, when they can't afford to take them to a doctor. And one of the things we see, because we work with foster care children, caregivers, is there's an increase in calls to a hotline. There's an increase in interaction with the foster care system for families, solely because of that poverty. It doesn't involve abuse of any kind, but that poverty just brings things into their lives that they wouldn't have if they had economic stability.
What could the legislature do, though, as far as the cost of food, the cost of transportation, the cost of housing, these sorts of economic conditions?
Well, they're doing some things right? They're putting money into the Affordable Housing Trust Fund. Very important, and they need to keep doing that. But there are other things, like there are a lot of grandparents in our state that are raising their grandchildren. Some are named kinship caregivers through the foster care system, and we're grateful to all grandparents who do this, but some don't. They're just helping out their kids. That maybe the kids have a substance use issue or going through a mental health issue or just not able to. And we used to have a program in Arizona where we would have a stipend for those grandparents, whether or not they were in the foster care system. We're bringing a bill to bring that back this session, and we really hope legislators pay attention to that one.
I was going to ask about foster care. Obviously, fewer kids in congregate care is a focus here. Is it heading in the right direction as far as foster kids are concerned?
Overall, we have less kids in the foster care system in Arizona, and that's important because we had a very bad trend going. The other good news, more kinship care placements. So more kids who are having to enter the foster care system because they can't safely stay with their parents. DCS is working hard to find their grandparents, their aunts, their uncles. The bad news is, though, when it comes to group homes and congregate care, there's a national movement because in 2015, there was bipartisan support for the Families Prevention Services Act, and that was signed by President Trump. And since then, states are moving away from group homes. But if you look at the data, and you look at this graph of, especially for kids 12 and younger, the littlest kids, the most vulnerable, other states have brought that way down here, and Arizona is way up here. We're all by ourselves as an outlier, and we just need more accountability for DCS to understand it is not acceptable in almost any situation for our youngest kids to be in group homes.
January Contreras, Children's Action Alliance, should be a very interesting session. Good to have you here. Thanks for joining us.
Thank you.